This podcast is brought to you by the Maryland State Library Agency. The MSLA podcast features presenters from statewide youth programs, as well as learning opportunities for library staff and resources for patrons of the Maryland State Library for the Blind and Print Disabled.
Hi, everyone. Welcome to another LBPD podcast. I'm so excited today because it's all about sleep. It is National Sleep Month, and one of the things that I know I need is more sleep. So having a 13-month-old means, well, by the time this comes out, 14-month-old means I don't get much sleep. But I have Dr. Wittine here, and she is a fellowship-trained physician with board certifications in pulmonary, critical care, and sleep medicine. She provides a wide array of consultative, diagnostic, and therapeutic services for adult sleep-related disorders. She is passionate about the benefit of sleep, and I can tell you from our previous conversation, she is very passionate and advocates that not only for sleep locally, but at a national level in leadership roles with the American Academy of Sleep Medicine. She is the medical director of Advent Health Tampa Sleep Center, and I would love to welcome her to her first LBPD podcast.
Thank you so much. I really appreciate the invitation, and I am excited to be able to talk about all things sleep.
Well, you and I had a chance to meet a little bit beforehand just to kind of get to know each other, and I have to admit I am so excited that you're here because you were just so cheerful and I am sleep deprived. So
Yeah,
anything you've got.
you are not alone. You are not alone.
Well, I'm
So
going to ask you one quick question before we get started.
please.
How did you end up in the world of sleep?
So this was kind of a tragic, serendipitous story because I went into medicine, and when I went into my training, I was convinced I was going to do pulmonary and critical care until I retired. And that was just the environment that I felt really, comfortable in and just loved. I guess I loved the adrenaline rush of it. But then, unfortunately, my first child had a birth defect, and that was devastating. And I was basically told I had to meet with NICU surgeons. And basically, they said, we've done everything that we can. There's nothing that we can do. This is not going to end well. And basically, your child is dying. And that was really, really hard. And especially when you're in an ICU environment, I have to have those same hard conversations with people on a regular basis. And after having kind of the tables turned on me and feeling the impact of that, I had a really hard time having that conversation and seeing hope drain from people's eyes as we had to discuss the realities of situations. And it was a knife to my heart, like every single time I had to have that conversation. And I realized that after a year, that I was going to burn out faster than, there's a high burnout rate in pulmonary critical care anyway, but I realized it was going to happen much faster with me. And so I was kind of looking for ways that, hey, I've invested so much time, energy in medicine. What can I do that still, encompasses a lot of what I've learned and a lot of my skill set? And so I started to look at sleep, and I made a pivot, and I went back to training. I actually stopped my practice, went back to training. And within 3 months, like, I fell in love with the whole discipline. And it was something that even after 6 years of training at this point, I hadn't even had that much exposure to, and how important it was. And once I saw the impact that I was having on people, on their quality of life, on helping to prevent very serious comorbidities, sometimes very serious cardiac comorbidities, I was like, it's better to prevent than to have to rescue from the brink when you're in the ICU. And I never looked back. And in fact, when I do have a patient who's like, thank you, you've changed my life, you've given me my life back. I was worried about losing my job. I was worried about losing my marriage because I was just cranky and moody all the time. I just send up a little message to, my daughter out there and say, thank you. Thank you. Nobody's ever met you. I never got to hold you, but at the same time, you put me on the trajectory I was supposed to be on. And so, in a way, that drives my passion for sleep because this is how I honor my first child.
I'm sorry, I'm tearing up, because you and I had a chance to talk, and you are so passionate about it, and to hear that story is amazing.
Yes.
Um,
So out of the
and
ashes came came a really, really incredible way to impact, people and society. And like I said, I've never looked back from it.
well, I'm grateful, not for how it happened, but for the fact that you're here because in our previous discussion, you talk so passionately about sleep
Yes.
and especially for, we talked a little bit about non-24 and
Yes.
and
Yeah.
things like that. And so I'm grateful that you're here.
Thank you. Thank you. I appreciate that. And I appreciate to share all things related to sleep. And I want to actually, first maybe start off before we talk a lot about kind of sleep hygiene and how to incorporate good practices into our regular daytime and nighttime routines, just to kind of set the context. Because I think when a lot of people think about sleep, and certainly before I learned everything I did about sleep, I kind of thought about it in this very simplistic way that you're either asleep or you're awake. It's like an on and off switch. And for some of us, that seems like it's going on and off all night long, but it feels like an on and off switch. And I want to kind of change that because consciousness is an on and off. Like you're either conscious or you're unconscious. But what might surprise people is that 50% of us in the first stages of sleep are not even unconscious. So, sleep is an incredibly complex physiologic process that is interacting with almost every other biological process that's going on. And it is helping to restore, reset, refresh those processes so that we're ready to tackle all of the stresses of the next day. So sleep has impact on how our immune system works, how we feel pain, our mood, our metabolism, pretty much every biological process. So there are people who have told me, throughout my career, they're like, "Oh, sleep, I don't really need sleep because I can sleep when I'm dead, or I can rest when I'm dead." Death and sleep are not even equivalent. Let's not aim for that. Let's aim for really, really good sleep because that's the one time, all of us want more me time. All of us want to have that. And it's built in me time where all of the resources of the body are turned inward and are working to restore yourself and prepare you for all of the stresses that we hit for the next day.
So, can I ask a question based on what you just
Yes.
said?
Yes.
Because, I'm one of those that will say, "I can rest when I'm dead." That is
It's
something that
very common.
my boss has heard me say over and over again, especially I'm in school, I work full time, I have a 13, 14-month-old, it just, I
Yeah.
can rest when it's time. But, you said that it's resetting our system and that
Yes.
we are not that consciousness is kind of subjective is basically what I heard. Is that correct?
Well, consciousness, either we're conscious or we're unconscious. We're aware of what's going on around us or we're not. But what we have to remember is that even though we're unconscious and we're not aware of maybe the other stimuli around us when we're asleep, there's a lot that's biologically happening in our bodies at that time. And that is helping to refresh and renew ourselves for, to kind of repair ourselves from the stresses that we just had and start to prepare us for the stresses that are going to come the next day. And that's why sleep is so important. And it's so easy to kind of forget about that importance. I even tell people like sleep is like waves on an ocean where it goes deeper, 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 lighter, deeper, 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 lighter. And while it's making those cycles throughout the night, different neurochemicals cytokines, hormones, a lot of different things that are going on biologically in the body are turning on, turning off. And that's having multiple different effects. So even though sleep just feels like, hey, I just laid there for, how many hours, there was a lot that was going on behind the scenes. And that's really important for people to have some awareness of.
I guess my big question is, you know, getting into that sleep hygiene mode.
Yes.
So
Yes.
what does a good bedtime routine look like, and how consistent should it be? Like, because for me, it's 8 o'clock comes and I start turning off the television. I start, well, that's not true. Right now, I'm falling asleep watching MASH. Um, love me some Alan Alda there, but by 9 o'clock, I'm in bed. I've got a baby jumping on me, but I'm in bed.
Yes.
What is a good bedtime routine supposed to look like?
Right. So why routine is important is just because, again, when we've got a very complex physiological process that's interacting with a lot of other processes, we want the timing of all of that to be very synchronous. I kind of compare it to people to like listening to a symphony. If you've ever heard, excuse me, them warming up and everybody's kind of doing their own thing, it's a hot mess. And then all of a sudden, all of the sections coordinate and they just produce this beautiful, beautiful song and symphony. That's what we want our sleep to be. We want it to be beautifully coordinated and really have maximal impact. We don't want it to sound like a hot mess, and we don't want to feel like one the next day either. So that's why timing and routine is important, because we want our circadian rhythm and we want our something called sleep homeostatic processes to maximally overlap at the right time. And how we get to do that is, again, setting those routines. And we seem to kind of get that for children, is that children seem to do better when they have structure, when they have routine. But I think, as you alluded to, when we become adults and we have so many different stresses and responsibilities that sometimes overlap, school as well as work, sometimes family care, sometimes taking care of parents at the same time you're taking care of children. There's so much on our plates that sometimes routine gets lost, but all of us thrive better with routine. And so the more we really try to focus on that and to set that, the better off we will we'll thrive more than just survive, if that makes sense. And so, how do I say this? For a routine, our body starts releasing melatonin about 2 to 3 hours before we even fall asleep. So our bodies actually start trying to shut ourselves down and prepare ourselves for sleep at least 2 hours before sleep actually occurs. So in a way, I try to tell people that, as you go into those 2 hours before sleep, you want to do things that are going to help prepare you for sleep. So you want to decrease really stimulating activities. You want to find yourself doing more relaxing types of activities, whether that's reading, whether that's maybe watching a little bit of television, whether it's cuddling with your kids in bed and talking about the day, any of those things. But we want people to have that time to both mentally and physically start to wind down to prepare for sleep.
I totally get what you're saying. How many hours should I be sleeping each night then? Like, should I get like 5?
Yes. So for adults, the best health benefits are seen at 7 hours of sleep. So the recommendation for adults is 7 hours or more of sleep. And we have been plotting sleep and sleep effects in regards to and in association to a whole bunch of different things, whether it's mortality, obesity, diabetes risk, cardiovascular risk, cancer risk, all of these different things. And 7 hours seems to be that really kind of pivotal point that has the best long term health effects. So that's why we really should be striving to get 7 hours.
Now, for some adults, that's going to be a miracle.
Yes, yes, absolutely. So again, I think it starts with prioritizing, trying to prioritize sleep as much as possible. And then also making sure that there are things that we're doing that don't sabotage our ability to get to sleep when we have that window for sleep as well, so that we can sleep as effectively, as deeply as we can. So, in part, again, the things that can sabotage sleep are if you have an underlying sleep disorder. So, if people suspect that they're not feeling as refreshed as by sleep, if they're having intrusive sleepiness during the day, those are things, if they're having difficulty sleeping, these are things that should prompt people to say, I need to look further into this. I need to talk to medical professionals and see if there's something that is causing me not to be able to sleep as well. Other things that we do when sometimes when we don't follow good sleep hygiene techniques, and sleep hygiene is not a treatment for sleep disorders. It's really there as a good offense, to help ward off poor sleep. But when there's a sleep disorder like obstructive sleep apnea, that needs other treatments and it needs other medical evaluation and advice, education, and treatment than sleep hygiene. But sometimes we are our own worst enemies because we do things that seem great in the moment, but it actually can sometimes sabotage our sleep for the next night and following nights. So that's why we sometimes, warn people or get concerned about people who like take naps during the day. Napping can reduce the pressure to sleep at night. Now, napping, a quick power nap can actually be really, really refreshing and help us to power through those afternoons and everything that we have to do in the afternoon. But if the nap during the day is decreasing that pressure to sleep at night to the point where we're lying in bed for an hour being like, I can't fall asleep, I'm wide awake, then that nap was actually more deleterious to us than beneficial. And we basically have to find ways not to fall into that trap, because if you're napping during the day and not being able to sleep at night, that just basically sets up the repetition where you're not going to sleep well the next night. You're going to have to nap the next day. That's going to decrease your pressure to sleep. So, some things that seem to be like, hey, this would help me, can actually have long term negative impacts.
Kind of like exercising right before bed, right?
Yes. So we worry about like vigorous exercise right before bed because of a few reasons. One is that that gets a lot of kind of adrenaline and other biological chemicals in the brain or in the body going that are going to be harder to kind of settle down so that you can get into that sleep mode. But you're also raising your core body temperature. And sleep needs to have deep sleep. Actually, the best deep sleep occurs as our core body temperature is dropping. So if we increase our core body temperature too much, it's harder to push into that deep sleep, or we're actually going to push off of our deep sleep until our temperature can lower. So it's not a bad idea. Some people to do some stretching exercises at night, just kind of limber, loosen up their body so that it feels more relaxed. Sometimes things like that can actually be beneficial for sleep. But if it's very hard, very vigorous, it can actually, again, just like you said, it can actually have negative impacts and not good positive impacts.
I'm just going to take that as advice that I don't have to exercise anymore. I'm just going to No, I'm
I'm trying to
kidding. I'm
build in as
kidding.
much context here as possible. I love it.
No. No, no, I really should be doing my exercises in the morning and not at night. I know, get the body up and moving and stretching out instead of like at 7 o'clock at night going, all right, let's go hit the treadmill.
Yeah.
Um, so something that you said, that there could be underlying reasons why you're not sleeping. There can be those, the things like the exercising or watching too much television or light noise and all that fun stuff. But What happens if you are diagnosed with a sleep disorder? Like what should you do?
Yes. So sometimes that can be handled by your primary care physician or provider, but sometimes you need to seek out a sleep medicine specialist. And in fact, that's what I do. So I treat all variety of different sleep disorders. One of the most common is obstructive sleep apnea, and that can be really hidden from people. So if you have a bed partner who can notice, hey, you're snoring, you're stopping breathing at night, you're gasping or choking, um, that's good feedback for a person to have to say, hey, I have something going on with me that maybe I need to explore with my providers. But there are several people who do not have the benefit of a bed partner to give them that feedback. And so they're oblivious. They're oblivious to whether they're snoring, gasping, choking at night. So the things to kind of be on the lookout for are you waking up multiple times at night with no real reason or explanation for doing so? Are you waking up with headaches in the morning? Are you excessively drowsy during the day? Are you finding yourself kind of nodding off, dozing off, especially when you're sedentary and you don't necessarily want to be falling asleep at that time, but sleep is just kind of overcoming you? Those are things that should start raising red flags that maybe there's something going on that needs further exploration. And it may not be obstructive sleep apnea at the end of the day. There are multiple different sleep disorders, from restless legs to narcolepsy to insomnia. And 1 out of every 10 Americans experience chronic insomnia in their lifetime. So these are not infrequent problems that people will encounter throughout their a lifetime.
You said 1 in 10?
Yeah, 10%.
That seems like a large number.
Yes, yes. And I think that's driven a lot by people having sleep disorders that maybe are not diagnosed. Just the just the anxiety and stresses of a daily life, and also just again not having the right sleep hygiene where it actually kind of works against you instead of for you. And so those are the things that I love this as a platform to be able to kind of educate, inform, and have people gain awareness of how common these issues can be.
I know I sent you some questions ahead of time,
Yes,
but one of the questions that just popped into my head is,
right.
can you define insomnia?
So insomnia is difficulty falling asleep, staying asleep, both of those, or feeling unrefreshed by sleep, even though somebody seems to have gotten the right amount of sleep. And we can define that further as to whether it's acute, meaning that it's within 30 days of a particular stressor. It can be subacute, about 1 to 3 months. But chronic insomnia is anyone who experiences trouble falling asleep, staying asleep, both of those that go over a 3 month period and affects them at least 3 nights out of the week.
And that's 10% of the population or more.
Yes. Will be affected by that at some point in their
Uh-uh. That just sounds, I mean, I've had insomnia. I think you're right. Everyone's had a touch of it at some point,
Yes.
and I didn't like it. I certainly don't recommend it.
Yes.
0 out of 10. For me, it was all related to my anxiety. So I had
Yes.
to learn to manage my anxiety so that I
Correct.
could get more restful sleep. Is
Yes.
that what you're seeing? Like, people need to manage stress and anxiety to deal with insomnia?
So, chronic insomnia, when it lasts 3 months or more, we actually have to take a very comprehensive approach to that. So, oftentimes, it's not just one factor, it's multiple factors that are overlapping, and we have to kind of just pull all of those issues apart. So, when someone comes to see me about the chronic insomnia, the first things, of course, that I have to think of is there a sleep disorder that is underlying this and undermining somebody's quality and duration of sleep. But I also have to think about medical disorders. I have to think about other things from a medical standpoint that might be interfering with sleep. Sometimes, especially for menopausal women, hot flashes can be extraordinarily interruptive to their sleep. Having to go to the bathroom multiple times at night, known as nocturia, having pain and chronic pain that wakes people up from sleep. There can be a lot of underlying medical causes that interrupt a person's sleep. And then the third thing is mental health. And is there depression? Is there anxiety? Is there PTSD? Are these factors affecting the quality of somebody's sleep? I have to think about the substances and the medications that people are on. There's a lot of medications out there that can affect whether somebody is overly drowsy or have trouble falling asleep. And so I have to figure out how those medications are playing a role in people's sleep. And then there was a question about caffeine and alcohol too. So, and then I practice in Florida. Florida has legal marijuana, but I have to consider the effects of all of those things on somebody's sleep. And then the last thing is, how is their sleep hygiene? How is the rhythm and the routine of their sleep? Because all of these things, can go amiss. And all of these things can feed on each other. And so a lot of what I have to do is kind of tease out and prioritize these and try to reset them.
That sounds like a lot of work.
Yes, but it can be very rewarding work too.
I have no doubt. I have no doubt because, in my head, I'm sitting here thinking, I'm like, oh my God, is that what my sleep doctor did? And
Yeah.
and she probably did.
Yes.
Another question that just popped into my head and not on the list, but
Sure.
what's the difference between insomnia and non-24?
That's a very good question. So, non 24 is considered to be a circadian rhythm disorder. So, there can be overlap in circadian rhythm disorders and insomnia, but we kind of classify them differently. So the circadian rhythm is basically a biological rhythm that's within each of our cells. So genetically, we are, predisposed to have clock genes that turn on and turn off organ systems throughout the body at given times. There's times of the day that our kidneys work harder, and sometimes when it works less hard, when we produce more stomach acid and when we produce less stomach acid. So each organ of our body works on a rhythm. And the circadian rhythm is kind of, when we think about it, it's a 24-hour rhythm. And that's coordinated. All of these rhythms are coordinated by one part of the brain that's called the suprachiasmatic nucleus. And that gives the rhythm to kind of set all of these and coordinate all of these other rhythms. And it does so, and it does so on a 24-hour basis, largely because of our exposure to light. So when blue wavelength light is present, it tells it tells that part of the brain to work at a certain rhythm, and that rhythm turns on and off other structures. And when the blue light goes away at the end of the day and it becomes more reddish hues, gray, other like that, it basically beats to it's a drum that beats to a different beat, and it turns on and off other biological processes. So our the non-24 usually happens in people who have blindness. It does not affect all blind people, but when people who are blind cannot sense light, they lose that way of synchronizing that rhythm to a 24-hour time period, because our innate biological rhythm is just a little bit longer than 24 hours. So light helps to keep that rhythm going to a day time span. And so that's why sleep happens at a certain time and wakefulness happens at a certain time. It's all part of that 24-hour rhythm. But when people cannot sense light, that rhythm can go longer than 24 hours. And they don't have a way of synchronizing as well to a 24-hour time frame. And most of us just take that for granted. So what will happen is they will start becoming sleepy later and later and later and later. So almost each day, their sleepiness gets pushed back by maybe a half an hour or so. So there are times when people have the 24-hour rhythm where they are in sync with a 24-hour rhythm. They're getting sleepy at night and they're awake during the day. But 2 weeks later, they're going to be out of sync. They're actually going to be sleepy during the daytime hours and awake at night. And that can be very hard for them to function in a society that really like kind of shuts down at night and is really active during the day. And so that can lead to insomnia. So on the times when they're out of sync, they're going to have trouble sleeping at night and they're going to complain of insomnia symptoms. I cannot sleep at night. I'm sleepy during the day. And so we have to kind of decipher why. Why aren't you sleeping at night? And is it because that rhythm is not in sync with where we want it to be? I hope that's a very technical explanation,
That was a great explanation
but
because I certainly didn't know any of that.
yes, yes.
Um,
And not all people who are blind are susceptible because there's different degrees and variations of blindness. So there are some people who their blindness does not allow them to see sharp images in detail, but they can still distinguish light and dark. So they may not be as susceptible to developing this.
and it can fold right into insomnia. Huh.
Correct.
I think in my head, before you explained it so well, um, that they were one and the same, but they're really not. They're really very
No.
different things.
So yes, and so circadian rhythm abnormalities, and there's many. So there, this is not non-24 is one type of circadian rhythm abnormality. Other circadian rhythm abnormalities are people who can sleep the designated amount of time, but they're sleeping just at the wrong time of day. So there are people who are the night owls who, they might not get sleepy until 3 a.m. and they'll take their 7 hours, until 10 a.m. But by then they've missed their morning classes or they're late to work and they're losing jobs because they're always tardy, always running late. And again, it's because they're getting sleep. And they might say that they have, again, they might present with insomnia symptoms. They might say, I want to go to bed at midnight, but I'm not tired then. I can't fall asleep. It takes me 3 hours to fall asleep. But it's just because their rhythm is kind of off from the norm. And so we have to not only address, okay, you're having trouble sleeping when you want to sleep, but we also have to reset that rhythm too.
Now, can you reset it with medication, or is it all sleep hygiene, or is it all like you have to go in and spend a week in a sleep institute? Like, what's the procedure?
So we use several different techniques. So medication, one of the strongest medications that we have for resetting rhythms and circadian rhythms is melatonin. But also, we can use the timing of light to our advantage. So, when somebody gets blue light exposure, when they get kind of red light exposure, can help kind of resynchronize those rhythms. As well as we have to have a good foundation of sleep hygiene too, because it's really, really hard when we don't have that foundation to be able to shift things and to move things as desired.
When you say blue light and red light, what it makes me think of are the new light bulbs that are out where you can
Yes,
change the color.
yes, yes,
Um, I have a friend who suffers from insomnia horribly, and she actually has a red light bulb in her room.
yes, yes, because
Yeah.
that red light is helping to turn again, once that's perceived by the retina of the eye and sends that message to the basically the circadian pacemaker in the brain, those red light hues again, change that to more of a rhythm that will support sleep, drowsiness, and start shutting down biological processes than the blue light exposure.
Now I want blue light glasses for the computer because
Yes.
I know I've done it myself where I've scrolled my phone. I'm
Yes.
laying in bed and I turn off the blue light.
Yes.
Um, scrolling your
But
phone at
this
right
is
before bed, it's probably a
correct.
no-no.
And this is why we caution people about really intense and significant blue light exposure from their phones, their tablets, their laptops, especially within those that hour to 2 hours leading up to sleep. Because of the blue light being emitted from those screens, it's giving the brain a mixed message. You're kind of like, hey, I want to wind down and go to sleep. But that blue light exposure is giving a whole different communication to your brain that, hey, it's still time to be active and to be in active mode and awake mode. So I'll be honest here. It's like confessions of the sleep medicine provider. I mean, there are times too where I actually use my use a phone at night. It's usually so that I can wind down my brain, so that I do something that kind of gets it out of, hey, I'm in racing mode, and just kind of like play a game or something that just gets all the other thoughts of the day out of my brain. But I do, recognize that at the same time that I'm trying to do that, I'm also giving it completely the wrong stimulus or the wrong message. So that's why, and that's why, especially with tablets, phones, that blue light hit is harder on those than even televisions. Because some people say, hey, I like to watch, a little bit of television before I go to sleep. But usually televisions are across the room or in a different room than their bedroom. And so it's not as intense of a blue light signal to the back of the eye. But usually where we hold our phones and where we hold our tablets are within a foot to 2 feet of the back of the eye. So that is a much more intense signal than like a television.
I'm shaking my head, and I'm shaking my head because I am so guilty of that. I do
Yes.
this I do. I'll like I said earlier, I'm rewatching MASH and it's across the room.
Yes.
I'm also scrolling TikTok,
Yes.
you know? So I've got a lot of light pollution, a lot of sound pollution,
Yes.
and how do you manage that in your bedroom environment? Because I mean, do you just have to be like, no, no more, or
Right.
are there tricks to the trade here?
Right. So I definitely, again, having that wind down period is really important. If we can do it without the use of phones, tablets, and things like that that are very close to our face or positioned close to our face, that would be ideal. So, like reading a magazine, reading a regular book. Again, the television, I'm not as much of a fanatic about, like, oh, don't use the television at night, because you can, is across the room, probably a lot less. The big thing is some people fall asleep because they fall asleep watching the television. And as long as you have the television on a timer, I don't have a problem with that, because it will shut off. You're already asleep. But when the television's going all night long, at some point it's probably going to wake you up, because even when we're asleep, we can still have times. And it goes back to what I said earlier, that sleep is like waves on an ocean. It goes deeper and then lighter about every hour to 2 hours. So as the sleep is lightening, you become more perceptive of noise in the bedroom, of light in the bedroom. And so when that TV is flickering or that TV is making sound, you're going to at some point be aware of it and be awake again. And so that's why I don't have problems with people winding down, just taking the stress of the day by watching television. It's not as direct a hit to the back of the eye, but you either need to turn it off to go to sleep. Or if you're going to probably fall asleep while it's on, there needs to be a timer to shut it off. So that way it doesn't interrupt your sleep and become a reason for you not maintaining that sleep.
See, this is where I'm going to plug our digital talking book machine. So our digital talking book machine, you put your cartridge in and it plays your book
Yep.
and you're listening to your book. It has a sleep button and it
Yeah.
goes up to 60 minutes. So you can
Yes.
set, and it goes 15 minutes, 30 minutes,
Yes.
like that. And I haven't, like I said, I'm guilty of doing all the things wrong since Molly has been born. But
Yes. Welcome to
I
parenthood.
it's a great club.
Yes.
Um
Yes.
the thing that I used to do is I would have my talking book player and I would set my timer and I would listen to my book and I'd set my timer and I would fall asleep and I wouldn't really lose too much of where I was in my book.
Correct. Yes.
So I'm just going to plug that
Yep.
if you are a or if you are using Bard, set your sleep timer so that you can listen to your book and read your book, but set your sleep timer. So I'm going to plug that because I think that might
That's
be a better alternative than TV.
exactly. Oh yeah, and again, you're getting rid of the blue light. So that's brilliant. So, just again, from I try to practice what I preach to other people. But for me personally, I'm a very light sleeper. I'm the one person who will hear a pin drop a mile out and like wake up being like, what was that explosion? And nobody else in the household heard anything. So I do as much as I can to kind of protect the sanctity of my environment. So I'm just going to tell you what I've done
Okay.
to help do that. So I do use face shields at night, and so I actually don't use just one. I use two. I use two on top of each other to block out any light. I do have light shades that I use to block out light at night. The big thing is opening them up during the day. So, just as important as having a nice dark bedroom environment, getting exposure to good, strong light during the day is also really important as well, for maintaining those rhythms. And I have a fan that I use all night long just to provide some white noise because just again, my husband breathing is enough to be like, oh my goodness. And he's the one who could sleep through World War III and not wake up. So it's always aggravating for me because I'm like, I am the sleep person, but I have to work a lot harder at it than he does to get a good night's sleep. So I use a fan. I even sometimes use earplugs, especially if I'm in a hotel or in a different environment where there might be other noises that I'm used to hearing. The other thing is, I actually did invest in a good mattress because just my husband turning in bed was enough to be like, gosh, darn it, now I'm awake. And he's not a restless sleeper, but there are some people who, I mean, they do flip-flops in their bedroom at night. And he's not restless, but it's enough to disturb me. So I was one of those crazy people at the mattress store who had to have my husband kind of bounce on the bed so that I could see if I felt it on my side. And I was like, okay, that's our bed. I didn't feel it. So what people experience is not, they're not the only ones. And so if I can just say, hey, I've had to kind of strategize and re-strategize how I think sleep and do sleep to make it work for me and to make it successful. Yes.
I'm the same way in a lot of ways. I can every time my partner turns, I feel it and I wake up and he can sleep through anything. I, on the
Yes.
other hand, I'm like always I feel like I'm always listening for the baby,
Yes.
you
Correct.
know. So
Yep.
I'm always listening for the baby.
Yep. Yep.
And it's been well over a year and I'm still listening for every little noise she makes
Right.
because it's that thing.
It does get
Conversation.
better
I'm
because
sure.
I'll just reassure you because that soon you'll just hear the pitter patter of little feet coming running towards you, and then you don't have to be listening for them. They'll find you, or they'll find you anywhere, everywhere.
I have 4 amazing, beautiful, bonus children, and, I met the youngest when he was 3, so I'm used to the hey, Ashley, where they're pulling my eyes open
Yes.
at, 5 a.m. The sun's awake, so am I.
Yes, exactly.
This has been great, a great conversation. And my last question to you is, if you could give one piece of advice, just one, for someone who is seeking out the help of a sleep doctor, what would it be?
That's a good question. So I guess people are having concerns about sleep. I would just say I applaud you for going and seeking extra education about sleep, extra evaluation about sleep, and treatment if there is a sleep disorder underlying it. I think the biggest, I guess, advice and what I really hope people will take away from this conversation is that our society is really governed to deprioritize sleep because we just have so many stresses and stressors during the day that oftentimes sleep is just kind of forgotten or it happens when it happens. But that actually can have significant negative consequences, not only short term, but long term. And, things like sleep apnea, um, especially for those who have severe sleep apnea, we know that that takes a significant toll on the cardiovascular system and can lead to premature death from stroke, heart failure, and arrhythmias. So we want people to seek us out, to seek out knowledge about sleep, just because it can impact so many different areas. A lot of times people don't realize, I work strongly with the bariatric department of my hospital, and a lot of times people blame themselves for making bad food choices and not having good portion control, not realizing that the amount of deep sleep they get can actually sabotage those efforts during the day because it resets specific chemicals in the brain that help us feel satisfied when we eat and help us to curb cravings for especially carbohydrate rich foods. So there's a lot of things that can happen wrong during the day that can actually have their origins in a really bad night of sleep.
That's really great advice. That's really great advice. So I'm going to wrap up saying thank you so much for being here and for doing this, especially from, so far away in Florida.
It's a
Um,
pleasure. It's a pleasure.
well, guys, thank you so much for being with us. Again, September is National Sleep Month. So sleep, 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 please. And if you have questions about your sleep, please reach out to your primary care and seek out the help of a sleep specialist. You don't need to wait until it becomes insomnia that's going to run on for 3 months. That's something that I'm walking away with today, is that I don't have to wait to seek out a specialist to help. So thank you, Dr. Wittine, for being here. We will see you next month, guys.
This has been a presentation of the Maryland State Library Agency. For links to additional resources provided by today's presenter, please visit the show notes. For more information on MSLA or the Maryland State Library for the Blind and Print Disabled, visit marylandlibraries.org.